So shall we start, sir? It's already
Yeah,
2
yeah,
with all.
yeah, I am ready.
Okay, sir, I'm
Can
starting
you
this.
hear me?
Yeah, sir.
Yeah, yeah.
Clearly you are audible.
Okay, okay. Shall I put the screen?
No,
Yeah,
sir,
share.
I will be introducing you, then I will hand over to you. Sir, with all your permission, I'm starting this session.
Sure.
Good
Please go ahead.
afternoon, everyone present here. I welcome all the participants on today's session. Let's welcome today's speaker with great honor, Dr. Shi Sarat Kumar, sir. Sir has done MBBS, MS, PhD in male infertility, FECSM, FPSM, DMRD, DRCOG, DGLS, FCGP, DYN, CUS, FCGP, Principal and Professor and Head of Department of Reproductive Medicine and Surgery, Mediwave Institute of Medical Science, Sayaji Rao Road, Mysore. Consultant sexologist and fertility surgeon at Apollo BGS Hospital, Kevamu Nagar, Mysore, and New Priyadarshini Hospital, Bridhavan Extension, Mysore. Today, sir is going to discuss on a topic structure and function of clitoris. Let me tell you overview of the topic. Clitoris is a small, highly sensitive organ of female genitalia that plays a crucial role in sexual arousal and orgasm. Despite its small size, the clitoris has a complex structure and function. The clitoris is highly inverted and thought to play an important role in reproduction. To know more about this topic, I would like to invite sir and hand over this session to sir. Over to you, sir. Kindly proceed from here.
Thank you very much for us. Before starting the lecture, I will start sharing the screen. Is the slide visible for us?
Yes,
For us,
sir.
is
It's
the slide
visible on
visible?
full. Yeah, sir. Perfect.
It's open. Shall I start?
Sure, sir. Stage is yours, sir. Proceed.
Yeah. Okay. Good afternoon, everybody. I'm very happy to be with you, all my professional colleagues, all the doctors from all over the world. I am extremely happy that IJCP people are arranging such wonderful lectures where we share our thoughts and experience with our fellow colleagues. So this afternoon, I've been given a subject, and an interesting subject, that is the structure and function of the clitoris. Now, Faraz already told that it's a tiny structure, but it has got an important role to play, not only in the sexual activity, but also in the reproduction. So that's why it's quite important. And let us start this. I'll be covering this topic under the following chapters. I will introduce the subject first. Then I will tell you about the parts of the female reproductive system, and then the parts of the vulva, and structure of the clitoris, neurovasculature of the clitoris, and physiology of erection of the clitoris, stimulation of clitoris, functions of the clitoris, and disorders of the clitoris. So these are the chapters which I'm going to cover. So before directly talking about the clitoris, let us just brush up our memory regarding the female reproductive system. Clitoris is a part of the female reproductive system. So female reproductive system is all located within the pelvis of the woman. It is made up of the vulva, vagina, cervix, uterus, fallopian tubes, ovaries, and the ligaments. So these are the parts of the female genital reproductive system. You can see the uterus, you can see the fallopian tubes, ovaries, cervix, and the vagina. And coming to the vulva, vulva of which the clitoris is one of the part. The vulva is collective term of several anatomical structures: mons pubis, labia majora, labia minora, vestibule, Bartholin glands, clitoris, and hymen. So friends, in the picture you can see the tiny organ clitoris, which is situated at the summit of both the labia majora and minora. This is the one which organ which we are going to talk today. This is the mons pubis. This is the urethral opening, and this is the inner lips, that is the labia minora, and these are the outer lips, that is the labia majora, and this is the perineum, and this is the anus. So all these organs put together, that is mons pubis, labia majora, labia minora, vestibule, Bartholin glands, clitoris, and hymen, they form the vulva. And coming to the today's topic, that is clitoris. Clitoris is the most sensitive area located at the summit of the vulva. You can see the entire thing is the vulva, and these are the two inner lips, that is the labia minora, and these are the two outer lips, which are labia majora. And at the summit, that is the apex of these labia majora and minora, is situated the clitoris. This is the clitoris, and you can see the parts. So touching this area, the body can make a woman feel sexually aroused and lead to climax or an orgasm. So clitoris is a stimulant organ, and it gets stimulated during the sexual arousal. You can see the parts of the clitoris also, which I'm going to come to you later on. You can see the suspensory ligament of the clitoris. This is the one. Prepuce of the clitoris, which covers the clitoris, clitoral hood, that is the glans penis. And this is the body and the root of the clitoris. This is the glans clitoris, which is seen from outside. So it has got two organs, that is external genital organs and internal genital organs of the clitoris. The glans penis, the glans clitoris is seen from outside, and the body or the root, they are the root and the body, they are seen from outside. So these are the external genital organs of the clitoris. And this is the bulb of the clitoris. This is the crust of the clitoris. This is the frenulum, which covers the hood, labia majora, which I would already do, and urethra opens below the clitoris. And this is the labia minora, and this is the introitus, that is the vaginal opening. So this is about the structure of the clitoris. Just to brush up our knowledge about the development of the clitoris, it is just female homologue of the male penis, and male, that is male penis as well as clitoris, they both develop from the genital tubercle of the fetus. So just like the penis, the genital tubercle is the one which gives rise to the penis, and the clitoris in male and female. Coming to the structure of the clitoris, a small part of the clitoris that is called, which is open outside, which is visible, is called as the glans clitoris. This is the glans clitoris. It extends out at the top of the vulva. So in the vulva, this glans clitoris is clearly seen. Under the glans clitoris is situated the urethra, and below that is the vaginal opening. And the two flaps of the skin around clitoris and vaginal opening are the labia majora and labia. So friends, you can see here, that is the clitoral hood. This is the clitoris. This is the urethral opening, you can see. And this is the vaginal opening. This is the bulb of the vestibule. This is the crust of the clitoris, that is corpus cavernosum. And these are the parts of the clitoris. The clitoris contains external and internal components. The external components are the ones which are seen from outside. That is the glans penis, the body of the corpora, that is corpora cavernosa. And the internal organs are the crust, which are not seen from outside. Hood prepuce, which covers the glans clitoris, and clitoral bulbs and frenulum. So friends, this is the glans clitoris, and this is the body. These two organs are seen from outside. That's why they are called as external components of the clitoris. And this is the prepusal hood, which covers the body of the clitoris. These are labia majora, and this is the labia minora, you can see. And these are the bulbourethral glands, and this is the introitus, that is the vaginal opening. And this is ischiopubic ramus. So this is the crust of the clitoris, and this is the root of the clitoris. So it contains the glans, body, crura, that is the legs, hood, that is the prepuce, and clitoral bulbs and frenulum. So these are the parts of the clitoris. And coming to the structure, the clitoris is made up of regular tissue, connective tissue, and muscle. It is covered with a clitoral hood that is formed from the upper part of the labia. It may look different in each different lady. See, this is the prepuce, this is the The body, the crura, corpora, cavernosa, and bulbs, together with the later three tissue, form the arms which hug the urethra and the vagina. So these are they form the some sort of arms which cover the urethra and the vagina. You see the crura, and you can see the bulbs. They cover the vulva, and they form the something like legs. And you can see coming to the extending internally from the glans is the shaft or the body of the clitoris, a small cylinder about 2 to 3 centimeters long. So friends, these shafts are just like corpus cavernosa in the male penis. It is exactly the same. See, these are the corpus cavernosa. It is similar to the penile corpus cavernosa. They are 2 to 3 centimeters in length. From the body extend the erectile corpus cavernosa and the bulbs. You can see the bulbs here. The corpora cavernosa and bulbs are continuous with two relatively long structures known as the crura, which are made up of non-erectile tissue. So, friends, in the clitoris, corpora cavernosa are erectile tissues, and the bulb of these are this, and bulbs, they are also erectile tissues. But the crura, they are not erectile tissues. They are non-erectile tissues. You can see the crura. Clitoris looks like an upside down Y. You can see. This is, just imagine that this is the vertical part of the Y, and this is the lateral parts of the limbs of the Y. So it just exactly looks like a Y, but upside down. This forms a single part of the Y. This extends down the branches off to the smaller two legs of the Y called as the crura. So these are the two crura. Crura are two longest parts of the clitoris. You can see that on either side of the crura. It is made up of the corpus cavernosa. And this is the glans clitoris. And this is the clitoral shaft. Shaft, glans, corpora cavernosa, and the crus clitoris. So these are the two limbs of the Y. So friends, you can see the Y shape, inverted Y, two limbs of the Y, and vertical part of the Y. Vertical part of the Y is formed by the clitoral shaft and the glans clitoris. The lateral limbs of the Y are formed by the crus clitoris. So clitoral hood has a normal anatomical variation in size and appearance in different adult women, while it is completely covered by labia minora, majora in some women, standing with their legs closed. In others, it is pronounced and visible. So this is how the clitoral hood appears in various adult women. Coming to the details about each part of the clitoris, the first part, of course, is the glans clitoris. Glans is composed of erectile tissue, and that erectile tissue is present within the labia minora. The glans may be noted as having glandular vascular spaces that are not as prominent as those in the clitoral body, with the spaces being separated more by smooth muscle than in the body of the crura. So this is the glans clitoris, you can see, and it is formed of the erectile tissue. And this erectile tissue is continuous with the labia minora. And this is the corpus cavernosa, crus clitoris, and bulb of the vestibule, and the vaginal opening. That is about the glans clitoris. The erectile tissue, adipose tissue, is absent in the labia minora, but the organ may be described as being made up of dense connective tissue, erectile tissue, and elastic fibers. So if you just enlarge the view of the clitoris, you can see the 3D view here. You can see the hood of the clitoris, glans clitoris, labia, and the arms of the Y shape, bulb of the clitoris, urethra, vagina. So the erectile tissue, adipose tissue, is absent in the labia minora, but the organ may be described as being made up of dense connective tissue, which is erectile tissue and made up of elastic fibers. Coming to the next part of the clitoris, that is the root of the clitoris. The root of the clitoris refers to the area where the nerves from the other areas in the clitoris meet up. The root is at the area where the legs of the crura meet, that is at the summit of the V shape, that is a Y shape. One may feel pleasure around this area because it's where the vestibular bulbs of the clitoris rub up against the vaginal wall. This may be the reason why vaginal orgasms are related to the clitoris. So friends, you can see in the picture, the finger has been put below the clitoris. And you can see this is the G-spot, the anus, the bladder, and the clitoris. You can see the clitoris here. This is the vagina, and this is the clitoris. Coming to the vasculature, blood supply, the dorsal artery of the clitoris is a terminal branch of the internal pudendal artery. This is the dorsal artery of the clitoris. It is just similar to the dorsal penile artery, and it is a branch from the internal pudendal artery. And dorsal artery provides clitoris with its blood supply, and the veins, that is this one, internal pudendal artery, internal deep artery of the clitoris, and dorsal artery of the clitoris. So this is about the blood supply that is comes from the internal pudendal artery. You can see the internal pudendal artery. It supplies most of the structures of the vulva, that is the around the anus and around the vagina. And also one of the branch is the deep artery of the clitoris. This is the deep clitoral artery, which supplies the clitoris, and this is the dorsal artery of the clitoris. Venous drainage, the deep dorsal vein of the clitoris is a vein which drains the vesical plexus. So from the clitoris, all the veins join together and form the plexus, venous plexus of Cobalt. This is the venous plexus of the Cobalt. And from here, the venous blood is drained into the deep dorsal vein of the clitoris. It is very similar to the penis. So where the deep penile vein drains the penis. In this one, clitoris, it is drained into a venous plexus of Cobalt, and from there, it is drained into the deep dorsal vein of the clitoris. You can see the plexus here, and drained into the deep vein. Coming to the nerve supply, the dorsal nerve of the clitoris branches off from the pudendal nerve to innervate the clitoris. It travels below the inferior pubic ramus to the suspensory ligament. The dorsal nerve of the clitoris splits into two nerve branches on either side of the midline, closely following the crura of the clitoris. So friends, you can see from here the dorsal nerve of the clitoris, which comes from the, you can see, yeah, here, pelvic nerve, pudendal nerve, and the nerve going to the clitoris here. This is the branches off from the pudendal nerve. You can see, follow the pudendal nerve here, which comes from the spinal cord. This is the pelvic nerve, this is the pudendal nerve, and pudendal nerve supplies to the anus, to the vagina, and ultimately into the clitoris also. So the clitoral nerve is a nerve from the dorsal nerve of the clitoris, which is a branch from the pudendal nerve of the lady. It travels from below the inferior pubic ramus to the suspensory ligament of the clitoris. So it goes up to the suspensory ligament of the clitoris. So dorsal nerve of the clitoris splits into two nerve branches on either side of the midline, closely following the crura of the clitoris. It is almost, friends, similar to the penile nerve. So coming to the physiology of the clitoris, coming to the clitoris stimulation, how the clitoris is stimulated. Clitoris is created from a network of erectile tissue similar to the tissue in a penis and nerves. So it is highly vascular, as well as it has got hundreds of thousands of nerve endings. Approximately, the gland itself alone has got 8,000 nerve endings. That's why it is highly sensitive and highly ergogenous. When aroused, parts of the clitoris swell with the blood. This leads to lubrication inside the vagina and allows one to feel more pleasure, especially during the vaginal penetration. So, friends, this is how the stimulation occurs. This is the mons veneris, man's pubis. This is the clitoris, and you can see the urethral meatus here, labia majora, labia minora, and putting the two fingers around the hood of the clitoris and gently rubbing it, it gives the stimulation to the clitoris. Direct clitoral stimulation involves physical stimulation by finger or tongue to the clitoris, that is the glans, hood, and the external shaft. So directly one can stimulate the clitoris just by the two fingers or one finger and by the tip of the tongue. The stimulation of the labia minora, inner lips, due to its external connection with the glans and hood, may have the same effect as direct clitoral stimulation. So stimulation of the clitoris need not be directly touching the clitoris. It could be stimulation of the labia minora also, and also labia majora and the mons pubis also. So because the nerve supply and vasculature to the clitoris is almost similar to the rest of the vulva. So stimulation by any means, either the finger or vibrator or tongue, it has got the same effect, but directly stimulating the clitoris, around the hood, gives the maximum pleasure to the lady. Due to the gland's high sensitivity, direct stimulation to it is not pleasurable, because the tip of the glans penis, glans clitoris, is so sensitive that rubbing the glans clitoris may be sometimes irritating. So it is not advisable to directly stimulate the tip of the glans clitoris. It is better to stimulate the sides of the glans clitoris, that is the shaft and the hood and the labia minora, rather than directly going and stimulating the tip of the glans clitoris, because it may be irritating in nature. And majority of women prefer use of hood to stimulate the glans, or to have the glans rolled between the lips of the labia, or for direct touch, or by the tip of the tongue. So most of the women, they don't like direct stimulation of the clitoral glands. It is the sides, that is the sides of the glans clitoris, that is they are more pleasurable, because the tip of the clitoris, that is the glans clitoris, it, if you directly stimulate, it may be of irritative in nature. Just like in men, men like to be stimulated by the shaft of the penis and by rolling the penis by the hands, rather than directly rubbing the glans penis against an hard organ. What happens when the glans penis is rubbed against an hard organ? There will be abrasions of the glans penis. Same thing happens to the glans clitoris also. It is so sensitive and so thin that directly rubbing it may be damaging, may cause irritation as well as abrasion, and it may be a negative effect of the stimulation rather than the positive effect. Hence, it is always advisable not to directly stimulate the glans clitoris. It's also common for women to enjoy the shaft of the clitoris being softly caressed in consent with the occasional cycling of the clitoral glands. See, you can see the various types of stimulating this one. So putting the two fingers, one on either side of the clitoral hood, or one on either side of the labia minora, or one on either side of the glans clitoris. So these are some of the techniques where the lady gets stimulation directly the clitoris as well as indirectly the clitoris. Clitoral stimulation, while in the missionary portion, usually results from the pubic bone area, the movement of the groins when in contact. So during intercourse, the contact of between the pubic symphyte, that is the male and the female, where rubbing between the two the pubic symphysis occurs, then the clitoris is stimulated. And the best position to stimulate the clitoris is woman on top position, or the coital alignment technique, a sex position combining the riding high variation of the missionary position with pressure, counter pressure movements performed by each partner in rhythm with sexual penetration to maximize the clitoral stimulation. So, friends, this is the exactly the sexual position which stimulates the clitoris to the maximum extent. The another advantage of this particular position is since the woman is on top, she is under the control of the entire act of intercourse. So she knows how much pressure is required for her clitoral stimulation. So how much extra pressure is required, or whether it is how the movement between the two pubic symphi will stimulate her. So she takes the control of the sexual activity and guides herself to get the maximum pleasure of the clitoral alignment technique. So this is the clitoral alignment technique. So forward, backward movement and upward, downward movement, that is rolling up and down the clitoris and rolling above and below by the thrusting action, that is the clitoral alignment technique, and pressing the penis in a gliding or circular motion against the clitoris, that is intracranial sex, or stimulating it by the movement against another body may also be practiced. So friends, in the picture, you can see the penis here. You can see the penis and the clitoris. It is being the two pubic symphysis. They are being touched. And in the clitoral alignment technique, the clitoris directly comes in contact with the shaft of the penis, and rolling the shaft of the penis forwards and backwards, upwards and downwards, it stimulates the clitoris to the maximum extent, and the woman gets the maximum pleasure out of it. So clitoral alignment technique is a modified version of the missionary sex, where the man rides a little higher, sliding his body up an inch or two so that the base of the penis rubs against the woman's clitoris. So this is the clitoral alignment technique, that is cat technique. So other forms of stimulating the clitoris or masturbation by using her own fingers or using a vibrator or a dildo, that is a human male-like looking like vibrators which look like the penis itself, which has got the same color or the texture as the male penis. So they are called as dildos, and other sex toys may be used for the clitoral stimulation by vibration. And some of the vibrators have got the magnetic tip also. They give additional pressure. And few women stimulate the clitoris by using a pillow or other inanimate objects by a jet of water during the bathtub or shower, or while having the passing the stools, or by closing their legs and rocking together, pressing the clitoral foot by the sides of the thighs, using the her own thighs and her own labia majora and minora to contract the shaft of the glans clitoris. So these are some of the methods of getting the pleasure out of the clitoris by self-stimulation using the vibrators. And one thing is the vibrator should not be applied directly over the glans clitoris, because the glans tip of the glans clitoris is so sensitive. Putting directly the vibrator may be sometimes irritating in nature. It is always better for the lady or the one who applies the vibrator to apply the vibrator to the sides of the glans clitoris rather than directly over the glans itself. Or the best is to apply by the sides of the shaft, that is the crura, or the legs of the clitoris, that is the labia minora. So they are the best positions to get the maximum stimulation by vibrators. And the lesbian couples may engage tribadism or ample clitoral stimulation or mutual clitoral stimulation during the whole body contact by themselves. So if orgasm is not achieved, the clitoris may remain engorged for few hours, which women often find uncomfortable. That's why some men complain that after the intercourse, they become irritating nature and they get headache, they get lose the mood, because they would have achieved the clitoral erection, but they have not released the orgasm. That is, they have gone to the peak, but the refractory period has not ended. In this period, women some women feel uncomfortable in the perineal region in the in and around the vulva. Additionally, the clitoris is very sensitive after orgasm, making further stimulation initially painful for some women. So after the intercourse is achieved, if the lady doesn't get the orgasm, then women will have some sort of discomfort. And this is how they get, because it is just like priapism. It is equivalent to a male person who has got erection and he does the intercourse. He doesn't release, the erection continues, and that erection will not be pleasurable. And sometimes it may cause priapism also, that is painful erection. So in the male, if the erection doesn't come down in the refractory period, the male person will have problem. Similarly, in the female, if the clitoris, which is engorged, if she doesn't reach the orgasm, it may remain engorged for a few hours, and which may be uncomfortable. In the picture, you can see the way the vibrator has to be used. It should be used by the sides of the shaft of the clitoris, not directly on the clitoral glands clitoris. So there are clitoral pumps also, similar to the vacuum pumps which we use for the men. The clitoral pumps are also available. They are little known. They are not that popular. They are totally underrated sex toy to increase the arousal. So how the clitoral pump is very, very similar to the penile vacuum pump, where the negative pressure is applied over the clitoral foot, and some negative, once vacuum is created, the blood is sucked into the clitoris, and the clitoris get engorged. That is, we create an erection of the clitoris by the vacuum created by the vacuum pump. So that's how the clitoral pumps work. The vulva pump, vacuum suction, and tantalizing, bombarding huge suction directly over the clitoris. It is similar to the penile vacuum pump. So penile clitoral pumps are advised to women who doesn't achieve orgasm, who are not happy with the sexual activity, who wants to get the pleasure out of the the sexual activity. They can use the vaginal vibrators, clitoral vibrators, or the clitoral vacuum pump. So clitoral vacuum pump, they are available, and mechanically one can exert negative pressure by suction, and it has to be placed directly over the clitoris. And this is how the vacuum pump, clitoral vacuum pump work. You can see. Clitoral orgasm. Vasocongestion eventually triggers a muscular reflex which expels the blood that was trapped in the surrounding tissue and leads to an orgasm. So vasocongestion eventually triggers a muscular reflex and the lady achieves the orgasm. A short time after stimulation has stopped, especially if orgasm has been achieved, the glands becomes visible again and returns to its normal state with a few seconds. That is, once the orgasm is reached, for 5 to 10 seconds, the clitoris continues to be engorged, but it returns to normal position about 5 to 10 minutes to return to its original size. And in the picture, you can see various types of vibrators available in the market. And this is how the vibrator can be used to stimulate the vagina, the clitoris. Coming to the physiology of erection, how exactly erection of the clitoris occurs, it is very similar to the penile erection, where there will be engorgement of the corpora cavernosa and corpus spongiosum in male. In female, there are no corpus spongiosum, only corpus cavernosa are there. There are two paired tubular structures which are situated around the shaft of the clitoris. You can see is homologous to the male glands and corpora cavernosa. Erection is reached in 3 phases: latent phase where there is no erection, turgid phase, that is semi-erection, and rigid phase. And the 4th phase is, of course, the refractory phase, where the clitoris come back to the normal position. That is the 4th phase. So we have 4 phases: latent, turgid, rigid, and refractory phase. The vestibular bulbs cause vaginal orgasm contractions through the rhythmic contraction of the bulbocavernous muscles. So that is how the erection is achieved. You can see the deep artery of the clitoris, and you can see the spongy tissues of the corpus cavernosa, and these are, of course, the superficial and deep vein and the clitoral fascia. And this is how, in the erection stage, the blood gets accumulated in the corpus cavernosum because it is a spongy potential space. It enlarges and it becomes erect. See, this is the flaccid state. This is the erection phase. This is how the clitoral erection takes place. By engorgement with blood during the sexual arousal, the labia minora becomes turgid, doubling or tripling in thickness. So the labia minora becomes thick. The corpus spongiosum of the female urethra becomes congested during sexual arousal. The male erection equals erection of the female erectile tissue. So, friends, this is the normal clitoris. You can see, as I told you, it looks like an inverted Y. And this is the hood, and this is the body, and this is the gland space. So, in the erected type of the clitoris, you can see the hood is expanded, and you can see the glands getting engorged with the blood, and the shaft and the root and the corpus cavernosa both are engorged, and this is the crurae. You can see that the crurae don't have the erectile tissue. That's why crurae in both the pictures, that is in the normal picture as well in the erect picture, the crurae, they are the legs, they are not engorged. Whereas the erectile tissues are the corpus cavernosa, they are erected, and the shaft of the body of the clitoris and the glans clitoris. They have all of these structures, they have got erectile tissue, and that's why in the erection they have become big. Coming to the functions of the clitoris, the single purpose of the clitoris is to give sexual pleasure. While entire vulva can be stimulated, the clitoris gives women the most intense sensations. And the other function of this, the procreate. That is, it has got two functions. That is procreative for reproduction and recreative, that is for pleasure. It is similar to the penis. The function is almost similar to the penis. You can see the anatomy of the clitoris and penis. Both have got the same type of erectile tissues, that is corpus cavernosa, and the glands, they are similar, and the bulbs, that is, they are similar, and the crust, they are similar. So this is the penis, this is the clitoris. In other words, the clitoris is nothing but a miniature of the penis in the adult female. Stimulating the clitoris activates the brain to cause combination of changes in the female reproductive tract that creates its readiness to receive and process sperm to achieve possible fertilization of the egg. So, friends, the clitoris is not just there to give the recreation, that is a pleasure, but it has also got another major function, that is the procreative function, that is the reproduction. It helps the reproduction of the female. So stimulation of the clitoris results in enhancement of the vaginal blood flow, increase in the vaginal lubrication, increase in the vaginal oxygen and temperature, and most importantly, a change in the position of the cervix and enhances the uterus. So this is the real function of the clitoris, which helps in the reproduction by increasing the lubrication of the vagina and increase the oxygen content, and also it makes the vagina warm, and also it makes the changes in the position of the cervix and entrance of the uterus that helps in the reproduction. This change brings the cervix away from cervix and prevents the semen from traveling into the uterus too rapidly, thus allowing sperm time to become mobile and activate to fertilize the egg. So friends, another important function of the clitoris is helping the lady to get the required environment for the reproduction. That's another important function. Last but not the least, disorders of the clitoris. Clitoromegaly. I am not talking about the major disorders. I am talking only about the common disorder. Clitoromegaly is one of the commonest disorder of the clitoris, which is seen frequently. It is larger than the normal, exposed to too many androgens. So there is sex hormones like testosterone, while in the fetus. So the clitoromegaly is usually due to misuse of the hormones, especially of the testosterone. If a lot of testosterone hormone is given, then the lady may land up in the clitoromegaly. And this can lead to congenital adrenal hyperplasia. This is in which the clitoris looks like a small penis. So CAH, that is congenital adrenal hyperplasia, is one of the conditions where the clitoris looks like a small penis itself. It is so much enlarged. Hormonal imbalance like PCOD can also cause large clitoris. So this is the normal female, and this is the clitoris, urethra, labia, and this is the enlarged clitoris. You can see the normal clitoris are almost, it is invisible. That is the clitoris. It is covered by the hood. Tip of the glans penis is just visible in the normal female, but in case of ladies who have got the clitoromegaly, it is very well seen. In fact, even the shaft is seen just like the penis. It becomes a mini penis like that. So female genital muscularization due to androgen exposure causes enlargement of the clitoris, and also it enlarges the two fused labia. So friends, that was about the anatomy, the function, and the structure and the function of the clitoris. I have covered this topic by giving you a bird's eye view about the parts of the vulva, parts of the structure of the clitoris, neurovasculature of the clitoris, physiology of erection, stimulation of the clitoris, and functions of the clitoris, and disorders of the clitoris. So clitoris is an important organ in the female. It has got a dual function, one procreative and another reproductive. So it it doesn't give only procreation, that is reproduction. It is an organ of recreation also. And how to stimulate the clitoris is an art. And that art comes by the adjustments and alignment, that is coital alignment technique, and understanding between the two partners, that is the male partner or the female partner. And some men have been reported that they just go and start rubbing the clitoris just like the hard mat. That will cause damage to the clitoris, because clitoris is a very, very delicate, smooth, soft organ, and it should never be rubbed roughly. So rough handling of the clitoris causes pain, abrasion, and also it may land up in negative feeling about the sex. So even during the missionary position, directly rubbing the clitoris very roughly may land up the lady in a negative feeling about the intercourse rather than the positive feeling. So friends, that clitoris is a delicate organ. It has to be handled delicately, smoothly, and better to use little lubricant, either an vegetable oil or at least saliva, so that roughly putting the finger around the shaft of the glans penis, and it may cause irritation. And also it's very important to note that the nails should be trimmed before stimulating the clitoris, because the nails, they may cause abrasions over the labia minora and the shaft of the glans, clitoris, and also on the glans, that may cause irritation and infection also. So practicing the clitoral stimulation is an art. It has to be done delicately. Use some lubricant, use your own saliva, handle it delicately. You get the maximum pleasure to the woman as well as to you. And the ladies also, if they want to stimulate herself, be careful, cut your fingers, cut your nails. And if you are using a vibrator, always cover the vibrator with a condom and also use some lubricant, because directly using the of the applicator, that is the vibrator, may cause infection if it has been lying outside and being used by others. So clean it, keep it neat and clean, and try to use it delicately so that you get the maximum pleasure. Never forget to use the lubricant. Any vegetable oil, coconut oil or olive oil or V-gel or lubricants which are commercially available, they can be used so that irritation is reduced, because it is almost a mucous membrane-like structure covering the hood of the glans clitoris. It is not rough, thick skin. That's why stimulating it should be done very delicately. So, friends, that was all about the structure, function of the clitoris, and also the physiology of erection and physiology of stimulation and disorders of the clitoris. So, any doubt or any question regarding this topic, you are most welcome to ask or send it by through the text. So, whatever the answer I can give, I'll give you. If the answer cannot be given, I will ask you to send the question through email so that I can contact you later on and give the further clarification if the right now, if the answer is not available. So, over to for us.
Okay, thank you so much, sir, for a wonderful session, sir, and taking out your precious time. I hope that all the participants who were there able to understand this topic, sir. Sir, we have received some question from the participant end. If you allow, can I take this question
Yeah,
without your
please
permission?
go ahead with the. That's why I have given extra time for the questions, because last time
Yeah,
we extended beyond the 1 hour. So this time what I
exactly,
did
sir.
is I restricted for 50 minutes so that 10 minutes question can be allowed.
Exactly, sir. The
Yeah.
first question I can see, what are the conditions affecting the clitoris?
Yeah, yeah, that's a very good question. And yeah, the first disorder what we usually see is the, well, as I already told you, the clitoral clitoromegaly. That is the enlargement of the clitoris. And so this is clitoromegaly. This is one of the condition of the abnormal condition of the clitoris, where the clitoris is bigger than the expected one. This is one thing. And second commonest condition is the phimosis of the clitoris, where the hood of the clitoris is being covered so much, the glands cannot come out. That is very similar to the male phimosis. That is another disorder. And at that time, what we have to do is we have to slit open the hood, that is the prepuce, and make the glans clitoris to come out. In case of clitoromegaly, we have to find out the cause, find out which hormones are derived, and try to give some estrogens and reduce the clitoromegaly if it is causing embarrassment and problem to the lady. In case of the phimosis of the clitoris, we have to make a small surgical incision and bring the clitoris glands out. And the other congenital abnormalities are similar to the congenital abnormalities of the vulva, a non-development of the clitoris, underdevelopment of the vulva, underdevelopment of the external and internal genital organs of the vulva. So they are all common to the vulva, that is overall to the external and internal genital organs of the female. At that time, it affects the clitoris also. And genital mutilation is one of the deadly complications of the clitoris. Of course, it is not practiced in our country. It is practiced widely in the African countries, where they do the circumcision of the clitoris, just like circumcision of the male penis. So at that time, they cut the clitoris itself and cause a lot of problem to the lady. She will never reach the orgasm in her lifetime, because she has lost her precious organ, that is the clitoris. So with the pretext of cutting open the prepuce, they would have damaged the entire glans clitoris itself. So that is called as genital mutilation, Of course, nowadays the awareness has spread even to those African countries, and most of the countries have banned this genital mutilation surgical procedures for the women. But still, it is being practiced in rural parts of the African countries who are still not so much developed. So these are some of the disorders of the clitoris. Next question, please.
Okay, thank you so much, sir, for explaining it really well, sir. Moving forward, I can see another question.
Yeah.
Yes, sir. The question is that what
Ah.
is an internal clitoris?
Internal clitoris. That is, I told you, no? There are
Yes, sir.
two parts of the clitoris. I'll show you again. It has got the external clitoris and internal clitoris. The external clitoris is the one which is seen from outside. Yeah, the development. Yeah, the external clitoris is the glans clitoris and the body of the clitoris, which are seen from outside. You can see in the picture. This is the external clitoris. That is the glans and the body, which is seen from the outside. The internal clitoris, that is internal components, are made up of four parts. That is the crura, they are paired structures, clitoral bulbs, frenulum, and the crus. So these are the internal clitoral organs. So just like in the male, the external penis and the internal penis. External penis is formed by the glans penis and the shaft of the penis. Internal penis is at the root of the penis, that is the corpus bulbosa. That is just like that. In the pin, the clitoris also contains the external part that is external 1 inch, and the internal part that is internal 2 inches. These are the parts of the clitoris.
Okay, thank you so much, sir. I can see, sir, one of the participant is asking,
Yeah,
sir, in patient of CAH with
yeah.
enlarged clitoris, can something be done cosmetically to enlarge the clitoris apart from medical management?
No, it's already enlarged. Why do you want to enlarge it? In case of congenital adrenal hyperplasia, it's already enlarged. So it looks like a small penis. So what we can do is first correct the physiology, that is reduce the adrenaline level and give more of estrogen. The clitoris may come back to original position. If it doesn't come back, then minor surgical procedures, we can just do a part resection of the corpus cavernosa of the clitoris and reduce its erection. That is, if it is causing inconvenience to the lady, we can remove a part of the corpus cavernosa and reduce the volume, overall length, girth, and the glans as well as the shaft of the clitoris. So surgical procedure has to be done to reduce its size.
Okay, thank you so much, sir, for answering, sir. I can see Dr. Renuka is asking, what is the objective measure for enlarged clitoris?
Yeah, same answer. Either if it is due to hormonal imbalance, give estrogens, reduce the level of the testosterone, that is androgens. The clitoris may come back to its normal size. If it doesn't respond, if it is causing inconvenience to the lady, then surgical intervention may have to be done. That is reducing the corpus cavernosa volume by resection, by removing part of the corpus cavernosa, and also to cut the glans penis to its size. That may reduce the volume of the overall volume. It is nothing but doing a resection of the part of the glans, clitoris, as well as the shaft of the clitoris.
Okay, sir. Thank you so much, sir, for answering all the questions, sir. As I can see, there is no more question from the participant end. As there is no more question, with all your permission, shall we conclude this session?
Thank you very much for us. Thank you very much for all the IJCP authorities for giving me a wonderful opportunity to interact with my fellow doctors all over the world. I am so happy that so many participants participated. And also, I thank all the people who put the questions, because these are all eye openers so that we can improve our knowledge by bilateral discussion on this subject. So thank you very much for your patient listening. Hope we'll see again with a new topic. Thank you. Have a nice evening.
Sir, thank you so much, sir. Until then, take care of yourself.
Thank you. Thank you.
Sir, we are closing here.
Yeah. Sure, sure, sure.